afternoon. I'm Carrie Fitzgerald, Vice President of Child Health Policy at First Focus on Children.
Hi, everyone. I'm Avery Pakulis, Vice President of Early Childhood and Public Health Policy here at First Focus.
Thank you so much for joining us here today. For those of you who are new to First Focus, we are a bipartisan advocacy organization for children dedicated to ensuring that children are a priority in federal budget and policy decision-making. Today's conversation is part of a multi-week conversation series that First Focus is hosting to mark the second anniversary of the World Health Organization declaring the COVID-19 outbreak a pandemic, and to examine the wide-ranging consequences for children. If you haven't already, I encourage you to check out our past and upcoming conversations in this series. We will make sure to share a link to them in the chat. During today's briefing, we'll talk about the impact the pandemic has had on child health and well-being. We'll hear from a maternal and child health expert about what children have experienced during the pandemic, the impacts on their physical health, their opportunities for vaccines, the widening disparities the pandemic has caused, and what steps can be taken to measure, address, and mitigate these impacts. A note that we will be taking questions after our conversation with our panelists. If you're watching in our closed door session, you can submit a question using the Q&A tab on the right. If you're tuning in on our website or one of our social media channels, you can participate in the live conversation by using the hashtag #KidsAndCovid. Post your tweets with the hashtag to submit a question.
We are going to get started with some remarks that Representative Kim Schrier from the state of Washington shared with us for this briefing. Congresswoman Schrier is the only pediatrician in Congress, and she has worked over the last 2 years to highlight the impact the COVID-19 pandemic is having on children, particularly advocating for vaccine eligibility and availability for children. So we really appreciate her sending these remarks to us. And here she is.
Hello, I'm Kim Schrier. I am the first pediatrician in Congress, one of just 2 women doctors in Congress, and I represent Washington's 8th Congressional District. I'm so happy to talk with you today because putting children first is your priority, and it is my priority as well, coming to Congress as a pediatrician. And let me tell you, these past couple years have been hard on children. They've been hard on all of us, but children really have less control than even we do over what is going on in their surroundings. And children have been hit to different degrees depending on their exact circumstances. For some, they have lost a caregiver or another loved one. For others, their families have suffered job loss and economic strains. For others, they were mistreated by relatives. And for others, they were just isolated from their friends and had to do school from home online. We've seen academic lags in those who could least afford them. And so we have a lot of work ahead of us to catch kids up and get them back to a new normal. I want to deliver good news too, which is that I have made sure we kept kids at the forefront of all of our rescue plans, making sure that we would have school meals even when school wasn't in session, making sure that kids could qualify and be certified for WIC and get those benefits despite the pandemic, increasing fresh fruit and vegetable benefits for families, for children, and also making sure that I am the voice in the room saying, but what about vaccinations for children? What can we do to make sure our children are in the classroom and in the classroom safely? That has been a priority of mine all along. And in fact, I believe that every decision we make outside of schools should be with the goal of having our children where they belong, which is in the classroom safely. I want to say also that as we talk about children and mental health and their academics, that children are resilient, that they will catch up, that if we nurture them and we provide that stability and encouragement, and if we can manage our own stresses, our children will come out of this stronger and just fine. And so hang in there. Let's get them through this. Let's catch up their academics. Let's catch up their regular vaccinations in addition to COVID vaccinations. Let's urge researchers to carry on those studies and get those who are under 5 immunized so those parents can feel more at ease as people are taking off their masks. And let's make sure we support our children, keep them in school safely, and give them the brightest possible future. Thank you.
Thank you, Congresswoman Schrier. Like us, the Congresswoman recognizes the many and disparate ways that children have been impacted by COVID-19. She's participated with us in past briefings and is a great friend of our organization, and we are very appreciative to have her with us again today.
It is my honor today to introduce Dr. Teresa Chapel to this conversation. There you are. Thank you. Dr. Chapel is speaking here today as a doctoral trained maternal and child health epidemiologist who has spent her career in governmental public health settings at the local, state, and federal levels. Thank you so much, Dr. Chapel, for joining us here today.
Thank you so much for having me.
Yes, we are looking forward to hearing from you about the challenges you have seen children and families face during this pandemic and hearing the recommendations and policy changes you suggest as we move forward. Before we begin this conversation today, we do want to take some time to honor the children whose lives have been lost to COVID-19. At this point in time, more than 1,400 children and youth in this country have died from COVID-19. Each of those children were loved and are missed by family and friends and their communities. All of us have lost the light and laughter and love they brought into the world. It's important that while we talk about the data and science and policy, we remember these children and honor them and their families. We thank all of the medical providers who have worked so long and so hard during this pandemic to protect and save children.
Thank you for that, Carrie. We do want to go over some of the data that we have about some of those children that Carrie just mentioned, and others who have been impacted in, as we've said before, in a variety of ways. I don't need to read all these numbers to you, but you can see some of them are enormous and startling. So we have over 12.5 million children who have now contracted COVID-19, and we have over 114,000 children who have been hospitalized. There are 7,400 plus kids who have developed the multi-system inflammatory syndrome in children, and we'll see in the next slide how that the disparities in that group of children are great. Speaking of disparities, this virus and this pandemic have, of course, magnified the disparities that we know existed before COVID-19, but have really been highlighted here. And we now know that well over 200,000 children have lost a caregiver due to COVID-19. 65% of those children belong to a racial and ethnic minority. The chance of an American Indian or Alaska Native child, for instance, losing a caregiver due to COVID-19 is 4.5 times the chance of a white child losing a caregiver to the pandemic. The rate of food insecurity is 3 times that of white children for children of Black and Hispanic households. And as I mentioned a minute ago, MIS-C, the percentage of kids who have contracted MIS-C, 70% of those are Black or Hispanic. So those disparities are really important for us to keep in mind as we talk about the various ways that kids have been impacted. And you know, the data is not perfect. We have those numbers, but by many people's accounts, these are probably lower than what actually exists out there. So we want to start with that data and now move into our conversation with Dr. Chapel. Carrie, I'll pass it back to you.
Great, thanks, Avery. That data is really helpful to sort of set the stage of what's been happening, where we're at right now in the pandemic in terms of kids. As we prepared for this briefing, we had a few conversations with Dr. Chapel, and over her career in public health, working state, local, federal government, she's seen a lot of the data and the situations and what children and families have faced over the years. And sort of some of the things that we've talked about is kind of why are we here? How did we get here? The pandemic, when the pandemic hit, kids weren't at 100%. Everything wasn't going great for them. But what sort of was the environment for kids before we got here? And then how did the pandemic impact them?
Yes, I think as a maternal and child health epidemiologist, I've really spent most of my career focused in on children's health, perinatal health, infant health, and really trying to figure out what is it that we can do to help enhance the health of children and families in our country. I think we need to kind of think about children as part of the community, as part of the life course and how their health is impacted kind of overall. And one thing that we notice is that um, children have fared better in this pandemic than compared to adults. And I think that's one piece that people have really held on to and have repeated kind of often, that children are at lower risk than adults. And so maybe that has also put us in a place where we haven't really focused in on, well, what is it that children are experiencing? Because we have made this comparison that we don't make when we're talking about other concerns that have to deal with children. So, like, for instance, when we're looking at asthma, we really focus in on childhood asthma and look at what that means and the impact that childhood asthma has on school, missing school and quality of life for children and things like that. We haven't made those similar, we haven't had those similar conversations around what does it look like for children when they have COVID. We haven't focused in and zeroed in on their experiences. Looking at like some data from National Center for Health Statistics, we have 40% or up to 40% of our children have a chronic health condition. We know that COVID has a more of an effect on people who have chronic health conditions. And yet when we talk about children, we don't bring that into the conversation too. Merck data says that about 10 to 30% of children are on medication for their chronic health diseases or chronic health conditions. And yet we don't talk about that when we're thinking about the impact that COVID has on children. So for me, I think it makes really good sense to have these conversations where we're really drilling in on children and not comparing them to adults, but comparing them to what a healthy childhood is like versus what a childhood is like once COVID has come into that equation for that child and for that family.
Yes, thank you. Exactly. At the start of the pandemic, which now is over 2 years ago, we heard consistently over and over that kids weren't affected by COVID at all. You may remember that. I'm sure you heard that. And as a mother, I'm sure you heard that. I certainly heard it. But what are the physical ways that kids have been affected by COVID? I mean, we went over, the hospitalizations, children who have died, children who got MSIC. What are some of the other ways that kids, when they get COVID, what happens to them?
I think this is a really important question that probably should have been asked from the very beginning instead of us just saying kids don't get COVID, right? We could say, does COVID look different when children get it? Do children experience COVID in a different way than adults? What's the impact of COVID on children, right? That could have framed our questioning, that could have framed our interventions, that could have framed our treatments, all in different ways. And at the beginning, even children weren't being tested for COVID because the thought was so strong that children don't get COVID. I think one of the things I like to bring up is that we had protections around children at that time point. And so it seemed like children didn't get COVID, but what we really had was schools, children weren't in schools. They weren't around indoor settings, crowded indoor settings where they could get COVID. Children weren't in, any of their extracurricular activities or after school activities, like all of that was shut down. So children were protected. They were cocooned within their household. They were cocooned within their communities. And so it seemed as if children didn't get COVID, but what really happened was that we had policy protections in place for children at that time to protect them from getting COVID. And we did not message it that way. And so
Right.
instead, the messaging was basically hijacked to say that children don't get COVID. Um, that messaging really influenced our ability to do research on this topic. It
Mm-hmm.
influenced our abilities to intervene once we saw that children were getting COVID.
Yes.
It also impacted our ability to track data on children during this time. So, listening to all the numbers that you read out earlier, you're absolutely correct that these numbers are undercounts. They're undercounts because, one, we didn't even start counting until late to
Yep.
see where we are with children in COVID. And so, other issues that children face once they have COVID, outside of the possibility of them getting the C, are things like long COVID.
Mm-hmm.
We haven't really have had full research on what's the long-term impacts of children in COVID and what long COVID looks like for children. One statistic that I hear often when we talk about kids and COVID is the educational lapses and test scores of 1 year compared to a pre-COVID year.
Right.
And some things that it doesn't explain is, well, I wonder if the amount of children who are dealing with long COVID when they take their standardized testing, the amount of children who are dealing with that brain fog that is
Right.
attributed to COVID when they take their testing.
Mm-hmm.
So I think we really look at like the proximal causes. Oh, well, maybe children are testing poorly because they spent a year or more in remote schooling. And we're not looking at maybe children are testing poorly because they're living in a pandemic. Maybe children are testing poorly because they have residual effects of having COVID or their family members having COVID, and therefore they haven't been able to learn as well or retain that information or test as well as they've done previously. I also want to talk about just um, we have a worry, or families or people have worried about heart inflammation as a result of the vaccine, but we see that
Mm-hmm.
more amongst children who had COVID than we
Right.
do with children who had the vaccine. And so, if we really want to focus on any potential kind of long term impacts that we think COVID brings, the best way is that we need to try and vaccinate our children from severe COVID and also prevent our children from getting COVID in the first place so that we don't have to deal with the
Mm-hmm.
issues that linger as a result of having COVID.
Right. Right. Thank you. I so appreciate your comments here. I wish you had been in some of our staff meetings the first year of COVID when I feel like we were asking the same things of each other. We kept saying, but we don't know what happens to kids. There isn't the data. The kids aren't getting tested. We don't know. And that was affirming to hear you pose those same issues to us. So thank you for that. In terms of collateral damage of COVID in kids, you've talked about some parts in terms of the physical, all of the physical impacts on kids. What do you think of as sort of the other, what else has happened to kids?
I think we don't talk a lot about kind of a few different components of it. What happens to a child when they find out they have COVID, right? So if we think about the time that we spend trying to protect our children from COVID and why we're telling our children they need to follow certain mitigations, why they need to do certain things, then what happens once that child contracts COVID? What is the fear like in that child? What is their, what immediate concerns do they have? So I just as a parent, I can recall saying to my daughter that you've been a close contact and now we're a few days post that and you're showing symptoms. So I need to take you to get tested. My daughter cried and did not want to get in the car with me. She did not want to put me in close contact to her if she were to have COVID. And so it's really like all of these pieces are like coming together to have this great impact on children. And yet we spend our time kind of focused in on certain components of it. We spend our time focusing on, well, what's the impact of this particular mitigation, or what's the impact of, social distancing? Well, we really need to look at the whole picture. We can't separate components of this pandemic. We are in a pandemic. The pandemic leads to sickness and illness and mitigations. And how do we address the way that children are feeling and handling all of these components at the same time? I think it's really important for us to think about, like, what are the things that we could be measuring. Um, as a scientist, as an epidemiologist, I'm always wondering, like, what are we measuring? Are we measuring the right thing? Are we forgetting to measure something? And here in this pandemic, I don't think that we are measuring all that we should be when it comes down to COVID. Deaths and hospitalizations are the tip of the iceberg.
Yep.
And so we really need to go and drill down a little further. Well, what happens before death? What happens before hospitalizations?
Right.
And um, I am very pleased and happy that people have access to home testing for COVID. But what that means is that we don't know at the population level, even the number of children who have COVID. We don't know the number of times a child has been tested for COVID. We don't
Right.
know the impacts of repeated testing on a child's psyche and what they have to go through. And we don't, I mean, there's so much that we just don't understand because we haven't measured it. We haven't asked the question, and we have just,
Mhm.
imposed certain things on children as we have gone through this pandemic.
Yep. I agreed. As you were talking, I was thinking about a couple of younger family members in my extended family who were 17, 18, 19. And over the last year or so, hearing them talk about the deep fear they had that they might have an illness that they didn't know they had, that they didn't have any symptoms of, but that they could pass along to their grandparents or parents, and someone could get very ill or die. And just that, deep-seated fear they held, like, every day. And it just kind of came out in random conversations. And I thought, oh my gosh, you're kind of carrying the weight of the world there, just going about your days. So I appreciate that. I'll ask one last question before we move to Avery's questions. And this might be a tough one. This might be a big one or a tough one, but what are you seeing parents and caregivers of children struggle with the most?
I think that this question kind of really would ebb and flow with the waves of the pandemic, right? So when we're at a point where there's so much virus in the community, where you're going through constant quarantines and isolations and your daycare is closed, the most trying part of the pandemic then would be, how do I keep my job? How do I work? How do I care for my children all at the same time while we're dealing with all of this? I think when the when the virus starts to decline and we have less cases, then your questions might be, how do I go about my daily life? How do I do risk assessment? How am I constantly supposed to be watching the numbers? How do I know when it's okay to take off my mask? How do I know when I need to put it back on? How do I know? A question I get often is from parents of children less than 2. Well, I'm wearing my mask, but my child can't wear her mask. And what do I do in this situation? Is it okay to take my child to the grocery store in these kind of situations where some people might be masked, some people might not, and my child can't mask? I think risk assessment is probably one of the biggest things, because it's always there, and it's always the answer that we give to parents is do your best. And parents are always doing their best. They're always trying their hardest. And yet still, we're telling them now, in the midst of a once in a century pandemic, that you also need to be an epidemiologist to figure out the risk of you and your family and what you're willing to take, and also what risk you're willing to impose on others that are around you, right? Because at least in my family, it is not just mother and father who are working with these children to make our lives go round. We need the assistance of grandma. We need the assistance of our neighbors in order to really be able to do all the aspects. And if I'm making a decision for my child in risk assessment, then do I need to take into account the people that my child goes around, the people who help me to be able to sustain the life that we have? And so I think like this is so much pressure that we're putting on parents and giving them very little information at the same time.
Yeah. Yeah. And I'll pass now to my colleague Avery. And this sounds like some of the conversations she and I have had over the last year about her family and her decision making.
Absolutely. Thank you so much, Dr. Chapel. I want to back up on what you just said. And are there ways that the federal government, state government, local government can provide some more information to help families and caregivers and parents make those risk assessments? What resources should be available to families as they try to make those decisions and navigate their lives with their children? Is that possible for us to improve the process that's here right now? Do you have any suggestions for that?
I think for me, it's kind of I would want to take a step back first. I think one of the things that all levels of government should have done and should have been led by our federal government is laying out our goal. What is our goal for the pandemic? We went 2 years without having a clearly stated goal as to what it was we were trying to do. In the beginning, it was we wanted to flatten the curve. But at some point in time, that goal was no longer there. And we went months and maybe more than a year without having a new one. Now, as of recently, the end of February, we have a new goal, which is to limit the amount of people in the hospital and make sure that our hospitals aren't overflowing. But when it comes down to it from a public health perspective, from a community health perspective, I really wonder why our goal isn't to prevent transmission, why our goal isn't to keep people from getting a infectious disease, when this is something that we've been doing as public health since the beginning of public health. Our goal has really been to limit the amount of preventable disease that's spread. And so I think we have what's happening in our communities is that some people are really focused in on that goal of preventing preventable disease, preventing disease spread from happening, trying to make sure that they don't contract and their family doesn't contract and that they don't give other people this virus that we don't know how it will interact with the person who we give it to, right? So we have one segment of our community and our population who's focused on that. We have another segment of our population that's focused on, well, let's just make sure we don't overwhelm our hospitals. And we can do that by getting vaccinated, getting boosted. And if we get COVID, then we get it. Or maybe it's not even a question of if we get it. The question might be when we get COVID. But working with different goals kind of across populations. And then these goals seem to vary based off demographics of people. We see that there's data out there that talks about mitigations and how they vary by race. There's early indication that minorities may be more cautious and more likely to keep mitigations in place, while those of the majority race are not. And so we really need to kind of understand like all these different interactions that are happening here and try and figure out what is our goal as a community? What is our goal as the United States? How do we want to move forward? And is it that we want to focus on individual protections, or should we be focusing on public health and protecting the health of our communities so that people who are immunocompromised can participate in communities, so that people who are too young to be vaccinated can still participate in their community? These are like real conversations that need to happen, and we need to be able to contribute to those conversations and say, if we pick one of these approaches, it means this for this segment of people. One of the questions I always ask is, who is most impacted by that policy? Who is left out when we're thinking about this policy? And I think that the most recent decisions that we're going to focus solely on vaccination and boosting leaves out children who are too young to be vaccinated and children who are too young to be boosted.
Absolutely.
I think Avery might be a little frozen. Is that right, Tim? Avery's frozen, I think. Okay, I can take it from here. So in terms of vaccines in kids, now we have them for kids ages 5 and up. What can we do to get more of those kids vaccinated? We don't have high numbers yet for those kids. What do you recommend? I know you've been involved in that quite a bit.
I think in terms of vaccinations in general, we haven't made a good case as to why people need to get vaccinated. Some adults that I talk to, when I'm trying to convince them to get vaccinated, some things that I hear from them is, well, that it's my decision and it's going to just impact my health. And so I can make my health decisions and no one else should care. We need to talk about the reasons why your vaccination status matters to not just you, but to your community. And then I think when we're talking about children, we need to add another layer on here. And that is the layer of dealing with the misinformation around the fact that children don't get sick. Children don't get, it's just a cold, it's just a sniffles for children. And so we can move on from there. So we're dealing with the fact that people think that their individual choice about vaccination just impacts them and nobody else in their community. And then the fact that, or the misinformation that children don't need it. It really goes back to kind of the mishap from the very beginning of the pandemic of not measuring in children and not explaining why children are protected. And then it goes to comparing children, a health condition in children to a health condition in adults. I think if instead we compared children to children like we should and like we do with other childhood diseases, we would see the really profound reasons why children need to get vaccinated. COVID has made it into the top 10 causes of death for children. And that is a piece of information that is not said enough, that people don't understand, that people don't hear. And so if we really have these conversations about the fact that children who are impacted by COVID can have life-changing events as a result of this, then that would be enough reasons for people to really start to think about vaccinating their children. I think that we also have to be creative in how we get the message to them and how we get vaccine to them. There's definitely differences in vaccine uptake amongst income status, amongst family income status for children as well. You have some parents who can easily take off to stand in line and get their children vaccinated no matter how long it takes. And then you have people who are working 2 and 3 jobs and can't get home in enough time to have a child that's awoke to then take that child to get vaccinated. So we really have to figure out, like, what's the family situation in the areas that we're dealing with? How do we impact? It really needs to be a local approach. How do we impact the families in our community? And who's the appropriate messenger in order to help make that conversion for families? It might not be, the local doctor, it might be the pastor, and we need to include whoever that appropriate messenger is in our campaigns.
Thanks, Dr. Chapel. I'm going to try this again. Hopefully, Carrie, thanks for taking over. I'll hand it back to you if that happens again. I loved what you just said about comparing children to children. We don't really do this adult-child comparison in other contexts. And I also, think that your message as far as who's sending the message or getting information to families and their kids is also a really important one. And it really highlights where we started at the beginning by saying we weren't necessarily in a great place for kids to start. So we didn't and still don't have paid family medical leave for families. And that's had a real impact on things like vaccination rates for various communities and families. So I think that you're making such a great point that so many of our policies that are focused on kids, that have impacts on kids and families, are linked, and they all need to be working in concert in order for us to have a successful response to, say, a global pandemic. I want to stick with vaccines for a second and talk about the hopefully the next age group that will be eligible for a vaccine, the 6 months to 4-year-old age group. And many of us are professionally and personally waiting for this age group to be eligible, and have been waiting a while. We do know, however, we've seen a study, for instance, from the Kaiser Family Foundation that tells us, at least as of a couple months ago, 31% of parents with children in that age group, the 6 months to 4 years, say that they will get their child vaccinated right away. About 30% say they'll wait and see. 12% say they'll only get their child vaccinated if they're required to, and a full 26% say they will definitely not vaccinate their young child. Those numbers have actually changed since I think last summer. Parents have shown a sort of a stronger desire to get their children vaccinated, but I think in this younger cohort, we're seeing potentially even more hesitation on the part of caregivers and parents. And I wonder if you could talk a bit about that and what is needed as we hopefully move forward into this next age group, and what do we need to do differently? I think you just mentioned some of that, speaking about messengers and things like that. But if you could really hone in on those younger kids and what might make that age group different, and the risk assessment, the decision making on the part of families different, and how we can help them make those decisions, would be great.
I'm really concerned about our push to return to normal when we have this age group of children who are unvaccinated. Because what tends to happen is that families have children that are spanning kind of this age group. I have 3 children. My youngest is 3, my oldest is 9. My 2 oldest are vaccinated, my youngest is not. When it comes down to returning to normal, how do we do that in a household where 4/5 of us are vaccinated? And then I think what tends to happen is that the youngest child just kind of gets brought along and does the rest of the activities, and we continue to keep our fingers crossed and hope and pray that they don't get COVID, and if they do, then it'll be mild, right? So I think that has been the messaging that's gone out to families, that it is perfectly fine for you to return to normal, and your under 5 child will be fine. I don't know how we change that messaging to say, and by the way, you need a vaccine that could be 2 or 3 doses for this age group. And I think that failure to kind of really push back on the messaging that under 5 are fine is really going to land us in a situation where we're going to have extremely low rates of vaccination uptake for those children who are under 5. I don't know how we turn the tide right now. I think it has been pushed by so many different communication efforts at families in order to get parents to be able to come back into the workplace. You had to feel comfortable enough to send your child to daycare who's under 5, and you feel most comfortable to send them to daycare because you've been told over and over again that even if they catch COVID, they'll be fine. I don't know how to change this messaging outside of really comparing the appropriate age group to the appropriate age group. What does it look like when children 0 to 4 get COVID? And we can talk about, the fact that a certain percentage do have really mild cases, a certain percentage are asymptomatic, a certain percentage recover quickly. We also need to talk about the certain percentage that don't. And that is the percentage that we don't hear about. That is the conversation that does not happen. What does it look like when you have your 0 to 4 and they need more intervention? How many ER trips do they need? How many pediatrician visits do they need over the course of how long? What does the cost look like for families that have to continually take off for their child 0 to 4 who now may have issues that they're dealing with in terms of long COVID? What does it look like with this age group as they are starting to learn and pick up new concepts at school? Is your 0 to 4 who had COVID compared to the 0 to 4 who didn't functioning at the same level developmentally? These are the conversations that aren't had because they don't go along with the priority that we've placed on kind of returning to normal.
Thank you. Yeah, we couldn't agree more with that. And I think from there, I want to turn a little bit to policy changes and recommendations that you think are needed. So certainly for those younger age groups, but also a little earlier, you talked about how the number of hospitalizations and child deaths are the tip of the iceberg, that we're not capturing necessarily the true costs, the true effects of the pandemic on children and their families. So are there recommendations you would make as far as trying to, on data, certainly on capturing some of those things more accurately, or other policies that you think, certainly the federal government, local and state as well, but that you think really need to be made and still can be made to put us in a better position to protect our kids in the most effective way that we possibly can?
Yes, and thank you for bringing up measurement, because I think that is a really important first step for any policy. We want data. We want to be able to point to some data and say, this is the need and this is the change we think we can achieve with a certain policy. And right now, what we have in place, we are only capturing a small amount of our COVID cases. And even within, what I tend to see is that when adults get COVID in the household and children start to show symptoms, oftentimes children aren't tested. They're just assumed to have COVID too. And so we're not getting those household transmission of COVID numbers for children. We're not getting the rapid test, home test results of COVID in children. We're not getting so many pieces of core data that could help us with this story and help us to even know kind of what's next. I worry about the lack of documentation of children's COVID cases and what that means when we start to try and look at outcomes a few years from now. If we don't have a documentation that says this child had COVID on such date, then can we really compare and say, maybe the results that we're seeing about developmental delays or lack of progress in school, we're not going to be able to make those comparisons. So one, I think policies around and that encourage appropriate data collection amongst children, appropriate testing amongst children. I think that is number one in order for us to be able to deal with anything that comes down the pike. I also think that making mitigations the easy choice is always what public health wants to do, right? Anytime that we can think about ways to make something safer that have minimum impact or minimum need for a person to contribute to, then we want to do those. So we think about the difference. We think about like airbags. We want to put those in cars. We want to put them everywhere in cars because you don't have to do anything in order to get that added layer of protection if you get in a car accident. We want to be able to do that with COVID too. Let's make ventilation in schools and in daycares and in bouncy house places and other places that children go. Let's make that the norm so that we don't have to say, oh, you have to wear your mask and you have to make sure that your 2.5-year-old is wearing their mask correctly and that it's tightly fitting over their noses and things like that. Things that are really complicated to do with young children. We should be making mitigations the easy thing, the natural thing, by making sure that we're doing them at the system level and not needing that level of individual input in order to make these changes. And then my last thing was that I think what we've learned kind of overall is that smaller class sizes are beneficial to children for so many reasons. And if another reason that smaller class sizes are beneficial to children is because it decreases the amount of any virus in the air, then this is another area that we can have policy and really focus on, making sure we have that smaller class sizes that can lead to individualized attention and healthier children and healthier teachers in classrooms.
Truly public health suggestions here. Those make so much sense. Obviously they'll cost some money, but we've come up with money for other things in the past. So thank you, Dr. Chapel. Is there anything else as we start to wrap up here? Is there anything else you'd like to leave us here with today?
One thing I want parents to know, especially pregnant parents to know, is that one way that you can protect your really young children, those newborn babies, those infants that we're bringing home, is to make sure that you are fully vaccinated and boosted. And that can provide a level of protection to infants that, it's currently not available elsewhere. So I think kind of if we're thinking about along the lifespan and how we can influence things and make changes, parents getting vaccinated and boosted, parents making sure that the children in their households are vaccinated, all this can work together to help protect our littlest ones too.
Thank you so much. Okay.
Well, we want to say thank you very much for coming today, Dr. Chapel. We not only enjoyed this conversation and learned from it, it gave us some good inspiration that we've needed to keep going forward in our work and how to talk about kids in COVID and think about policy. So thank you very much for joining us today.
Thank you for having me. It was a pleasure.
Yeah. Great, thank you. And we want to thank all of you for attending, and we hope that you will register for the rest of the conversations in this series on kids and COVID. Thank you so much.